We can also tell you tonight that there appears to be an increase in the number of elderly persons contracting and dying from COVID-19, and those numbers are growing. Consultant physician and director of services of the Geriatrics Hospital at the Sandilands Rehabilitation Center, Dr. Indira Grimes, says elderly persons between the ages of 65 to 80 years old are at a greater risk for the virus due to weakened immune systems and pre-existing conditions. Dr. Grimes says based on her personal encounters, this vulnerable group requires hospitalizations, intensive care, and ventilation due to the aggressiveness of COVID-19.
According to the World Health Organization, WHO, data from April 2020, more than 95% of the COVID-19 deaths were among people over 60 years of age, and more than half of those deaths occurred in persons over 80. Those most susceptible appear to be residents of nursing homes and assisted living facilities, being in close quarters and dependent on others for their basic personal needs and care. Social distancing and isolation has also caused difficulty and stress for older persons. Particularly, it has led to loneliness and increased risk of elderly abuse. It's decreased access for older persons to health care and social and spiritual support systems, all of which could negatively impact the mental and physical health of older persons, leading to depression, high stress, and even self-neglect.
Dr. Grimes offered these preventative tips to members of the elderly community that they should adhere to avoid contracting the coronavirus.
To help prevent the spread of COVID-19, one needs to know and understand how the virus spreads. It spreads from one person to the next in close contact, that is, they are less than 6 feet apart, and it spreads through respiratory droplets produced when an infected person coughs, sneezes, or talks, and the droplets can be inhaled through the mouth or nose, thus spreading the infection. Everyone should wash their hands often for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Cover your mouth and nose with a mask when around others, even around close family or friends who are visiting.